Hi, this is Dr. Jessie Tierney with the Healing Collective Functional Medicine in Niwot, Colorado. This is my first live. We're going to talk today about concussion and the current model for treating concussion, as well as solutions that may be alternative but much more effective than what we have to offer in mainstream medicine. Give me a few minutes here. I'm going to get my live set up so that I can contribute some content here and share this with a couple other groups. So bear with me for about 1 minute, and then this talk is going to be about 15 minutes long. So get yourself ready, and I will be joining you in just a few minutes with this awesome content about concussion. I see some of you have joined me. Thank you so much. I'm just getting this live coordinated with a couple of other groups where I'm going to share this information. So bear with me, and I'll be with you shortly to present this information, about 15 minutes worth, on concussion, specifically how concussion can help with insomnia, but also general treatment strategies for concussion that you may not be aware of. So give me just a few more moments to get this set up to my groups. Sharing it with my Resonance Rising group, which is a frequency medicine group. And I'm also sharing it with my group called Sleep Soundly. And this is a group for women with insomnia. And I'm also working right now to share this as an offering on the Healing Collective Functional Medicine page, which is the clinic that I work at in Colorado. Okay, let's see. So I welcome you all. Thanks for joining me. My name is Dr. Jessie Tierney. I am a physical therapist. I have my doctorate degree in PT, and I also have a background with therapeutic yoga for over 12 years. And I'm really excited to present this information to you today. Concussion is a huge problem in our culture. It's way more prevalent than we realize. And I have a special passion for it, which I'll tell you about in just a moment. And I'm really excited to share with you this important information about concussion. So I'm going to try to keep it brief, down to 15 minutes. I apologize for the late start, but let's get going. So please, if you have any questions, just put them below in the comments box, and I'll definitely address them at the end of the talk, if not as we're going. And so for today, what I really want to do is just make 3 important points about concussion. The first point is that far more people have brain injuries than we think or realize. The feature of being a human sets us up for a brain injury. Bonking yourself in the head, on the door when you get out of your car, the cabinet. And then also, there's this concept of accumulation over time. If you're not aware of the term second impact syndrome, it refers to like kids in sports or adults in sports who get a blow to the head, and then before they're fully recovered, get another blow to the head. And the impacts of that are exponentially challenging to deal with. And then if you're an adult, but you used to be a kid in a sport, you probably had some kind of blow to the head. And then these cumulative effects add up over time. So that was the first point. More people have brain injuries than we think. The second point is the solution to concussion really does not exist in mainstream medicine. And this is because the mainstream model just doesn't offer enough. it's not a very active approach to treatment. It's like rest and gradual return to sport, etc. It doesn't really do things for people who maybe don't recover in that first week-long window of recovery for concussion. So I'm here to sort of help you understand that there's lots more options. So the third point is there is hope, and there are plenty of strategies that do exist that are effective for people that help you overcome concussion. So those are the three things we're going to be talking today. Let's see. Okay. So I see from Tracy that the volume's doing okay, and Sue Tierney can see you on my phone but not my computer. Okay, well, just watch on the phone then. Thanks for being here. All right, so let's get going. I want to tell you why I'm so passionate about concussion, about helping people. And the tone of this presentation might be a little intense, and it's just because I have so much experience seeing people suffer and then trying to get through the mainstream model and not finding the solution, and then here are solutions. So I'm really passionate because back in 2014, my best friend was in a work accident where he works outdoors for his job. A big boulder came down and hit his head. And so that was definitely an incident for him. But then also after the boulder hit his head, he flew back against a tree and hit his head again on a tree. Went to the doctor that same day. The doctor diagnosed him with a shoulder strain. The doctor did not screen for concussion, did not give him a CT scan, did not do anything to even acknowledge the possibility that this individual had a concussion. So almost immediately he was having symptoms where it was hard for him to be in places that had bright lights. He couldn't go to the farmer's market without feeling totally freaked out and overwhelmed. He couldn't read his computer screen without getting a terrible headache. And back in 2014, we didn't know anything about concussion. We didn't even make the connection that that was what he was experiencing. And his doctor certainly did not make that connection for him either. So a long story short, after a few years of suffering with these symptoms and kind of coming and going, his symptoms started to amplify. And so this is an example of those cumulative effects of concussion and how they can grow over time and make things worse. He wasn't sleeping. He had heart problems. He had blood pressure problems. This was a very fit, outdoorsy individual. And then all the while, he couldn't access quality care because his misdiagnosis of a shoulder strain. In his workers' comp claim, they said it was a shoulder. They didn't even acknowledge that it was a concussion he was dealing with. So it was a mess, right? And it was totally impacted his life, and it impacted the lives of people around him. And so that was horrible, right? What was the turnaround was when he discovered some alternative treatments to concussion, and that's what I'm going to talk to you about today, because those alternatives, understanding what was happening, understanding that it was a concussion, and then understanding this systematic process of helping the brain recover and repair was essential. And this is not something you usually find in most doctors' offices. So how do you know if you have post-concussion issues? Now, this isn't diagnosing you. I'm just offering a list of possible symptoms that might indicate to you that you have some kind of a brain injury. Headache, fatigue, photophobia, which is light sensitivity, sensitivity to sound, if you have sleep dysfunction. So this is a big shout out to all my ladies who are here from the Sleep Soundly group. Thanks for joining us. I really hope this information is going to serve you well. So sleep dysfunction can be sleeping more than usual, like spending a lot of time in bed, or sleeping less than usual. With my Insomnia group, that's what this group of ladies is experiencing. Trouble falling asleep and trouble staying asleep. Visual problems, hearing problems, tinnitus, anxiety, depression, nervousness, increased irritability, like you just get annoyed more easily than you used to, and even PTSD. So, far more people have brain injuries than we think because we used to diagnose concussion as a loss of consciousness, right? So you had to be blacked out in order for us to call it a concussion. The mainstream medical model has evolved since then and does acknowledge that concussion can be even a small blow to the head. There's examples where people get totally smashed in the head in a football game and get up and are fine and have no symptoms. And examples where somebody gets just nicked in the head, but for some reason, because of the forces in the cranium and the shearing that happens with the dura in the brain, that person has a severe concussion that's debilitating to their career, right? So it's not easy to diagnose because there's a huge range and there's not one thing that you can point to and say, oh, this is why you have a concussion. Usually there's a blow to the head, but it doesn't have to be a big blow. Right? It can be something small. If you have a big blow to the head, then it's likely that you have some kind of trauma to the brain. The brain is amazing. It's able to rejuvenate itself. It's able to heal itself. But if there are other underlying factors like toxicity, like congestion, like an inability to have the fluid that flows around your brain flow easily, or congestion in your lymphatic system in the brain, then the brain has a harder time healing. The older you are, the more exposure you've had to the world and toxicities, the more these problems, these elimination problems or detoxification problems can be getting in your way of healing fully from a concussion. Let's see. Your solution, so this is point number 2, your solution does not exist in the mainstream medical model. And maybe it does, right? Maybe you are one of the people who got a concussion, go to bed or in a dark room for 24 hours, engage in a very gradual, guided return to activity, and then you're fine. You healed and you're great and you're back on the field or back doing what you love to do. But I suspect the reason you're watching this is you're perhaps one of the people who has gone through that process and the symptoms are lingering or worsening, right? And it can be so frustrating to be working through a medical model that says, well, by 4 weeks, you should be fine. You should be better. And if you're not, if you don't fit into that model, we don't really have anything to offer you outside of maybe some medication or just learn to live with it. That solution is not acceptable. We are doing a great disservice to people by saying if you're not better by a certain amount of time, it's probably a psychological problem, or it's probably just something you have to live with. Like, that's just not true. Okay, it's unethical in my opinion. So I attended a 2-day presentation in West Virginia just a few years back, and it was like presenting all of the latest evidence-based research on concussion. And I was horrified by the lack of actual solutions. It was like if you didn't fit into this model of a specific type of concussion diagnosis, you got lumped into it's psychological, go get some psychotherapy, and you should be better from that. So like I said, I'm really passionate about getting this information out there because it should be widespread. It should be really easy to access, and it's not. Right. So what I did take away from that 2-day seminar on concussion is that there are different types of concussion. Right? Some concussion can primarily affect the visual system. Some concussion can primarily affect the vestibular system, your balance and your proprioception, your awareness of where you are in space. Some can be more emotionally impactful. Some can be related to actual brain changes, chemical changes, which many concussions are really have cytokine changes and changes in the chemicals of the brain. So the treatment of concussion can't be one size fits all because each individual person comes with their own makeup, their own history, their own, diet that they follow, their own activity levels. So you can't group people into a clump and say, this is how we treat this group of people with concussion. It has to be a one-on-one individual treatment plan. It just has to be. Let me just check in and see if anybody has questions or comments. Hi, Gail. Thanks for joining us. Okay. Looks like we're good to go. So again, if you have questions or comments, go ahead and send them down in the comments box below this video, and I will address them at the end of my talk here. And I'm glad you're all here. Thanks for joining me. Okay, so second point, the solution to concussion does not exist in mainstream medicine. I think I've hammered that home pretty strongly. So now the part you've all been waiting for. There is hope, and there are strategies to overcome these effects of concussion, these frustrating, life-changing effects of concussion. And like I said, this is not mainstream information. This is not something that you will open your medical textbook and say, oh, here's how you treat concussion. This is new. This is leading edge information. So I'm going to drop a Facebook page into the comments here, because this place is why I know about some of these alternative treatments to concussion. So do y'all see it there, the Simkevich Concussion Institute? Like that comment that I just added if you see it, just so that I know. So when I was first delving into alternative treatments to concussion with my best friend who had that huge work accident, we came upon the Simkevich Cranial Institute, or Simkevich Concussion Institute is what they are called now. And this approach to treating concussion made so much sense. Dr. Simkevich taught us that when there's a blow to the head, yes, the brain inside of the cranium shifts. We know that. You will find that in a textbook. It's called coup-counter-coup reaction forces, and it's where the brain inside the cranium can actually like hit the side of the inside of the cranium and then bounce back to the other side and hit that side too. So sometimes the impacts on the brain are worse, not, if the head hit, the ground or whatever force it hit on this side, sometimes the effects of the concussion are present on the other side of the brain. That's coup-counter-coup. So yes, the brain and soft tissues inside of the brain move around inside of the cranium as a result of concussion. What the Simkevich Cranial Institute taught me is that not only does that soft tissue inside of the cranium move, but also the cranial bones themselves shift, right? And it might not be a huge shift, but it's a shift enough that it impacts the structures, the sort of waste disposal system in the brain. And so if you're not familiar with what the cranial bones even look like, I'm going to drop a picture in the comments right now. Maybe. Let's see. I'm just going to open this image that I found, the bones of the cranium and the cranial base. I'm putting that in the comments now. You can click on that and just take a look at the picture that comes up on the screen. So the cranium, the skull, just one solid structure. It's these separate bones that all articulate with each other. Now, if you look in a mainstream medical textbook, it'll tell you that the cranial bones typically fuse by age 23 or 25. What we have found in clinical practice is that that's just not true. The cranial bones have tiny, tiny micro movements that are accessible. And in a concussion, in a blow to the head, those bones can just get a little tiny bit out of place, right? And if you look at this picture, if you look at the yellow bone, the sphenoid bone, and it's a challenging way to view it because you're looking from the top down in this picture. But essentially, the sphenoid bone has this little cup, right? It's called the Turkish saddle, and your pituitary gland sits in that cup. Right? If the sphenoid bone gets sheared or moves in such a way, it's going to impact the way that your master gland. This is the gland that's also associated with your sleep wake cycles, is going to be impacted. It's not going to be sitting in the correct position. If you look at that yellow bone, you see that it articulates with nearly every other bone in the cranium. The frontal bone, the blue one, touches the yellow bone. The parietal, the green bone, touches the yellow bone. The temporal, the red, the occipital, the orange, even the ethmoid bone on your nose touches that sphenoid bone. Okay, so when you understand the structure, you understand that if something gets shifted, it can impact the function of the brain. The holes that you see, these are called foramen. The holes that you see are where nerves travel through, where blood vessels travel through. So the information highway from your brain, your cranial nerves, if those bones are shifted, it can impact the ability for that nerve to function, the blood to flow through the brain, the lymphatic system. We only learned in 2015 in a rat study that our brains actually have a lymphatic system. That's new science. We just learned that. And our understanding of that leads us to know that if that system is clogged, if that system is not efficient, if the hole that the lymphatic system goes through gets smaller or shifted because of a shift in the cranium, you're just not going to be as efficient at eliminating the toxins out of the brain. When you have a concussion, the toxic load increases because the brain is trying to just clean it out, and it's adding cytokines and inflammatory markers to help clean the destruction that happened from the brain injury. So things get congested, things get inflamed, and then things get worse. Your symptoms get worse. I'm going to drop a link in the comments now about an awesome study that was done just a few years back on craniosacral therapy and visceral manipulation in the treatment of concussion. And this was a study done on football players from Canada and the US who had like major post-concussive problems. Their careers had ended, they were later in their careers, and they did this intervention that looked at the movement of the cranial bones, and they did it in a really subtle way. And then also visceral mobilization. They can do manual therapy with their hands to help improve the mobility of the vagus nerve and other organ structures in the body so that things can flow and detoxify naturally. So, the structure of the cranium is essential in looking at post-concussive problems. You have to make sure that things are aligned so that your brain can detoxify itself. Because the brain it has the ability to do that, but it makes it harder when things are out of alignment. Just going to check in and see if anybody has questions so far. Thanks so much for being here, everybody. Okay. And I'm going a little overtime, but I have a lot to share, so I'm just going to keep going. Thanks for bearing with me. So, structure of the cranium can be helped. It is one of my specialties. I love to treat people's craniums. It's fun because it makes a difference, and it's amazing. It's amazing. It changes people's lives. So, you have to look at the structure of the cranium and the neck when you're treating concussion. You also have to support healing and brain regeneration with diet and supplements, right? This is something that has to be dealt with on an individual level. I wish I could say, oh, you had a concussion, take these 10 supplements and it'll be gone in 3 weeks. But that's just not the way it is, right? We have to understand the chemistry that's happening in your body right now in order to know how to prescribe the right supplements. I work at a functional medicine medical clinic, and it's wonderful because I have providers that I say, oh, so-and-so has a concussion. I need you to check his labs to make sure that we're putting him on the right supplements. And so we do this wonderful interdisciplinary approach with Tracy. She's here watching live. And we get somebody's lab results and we determine what's the best way to support the detoxification process for the brain and the regeneration process in the brain. Also, diet is important. An anti-inflammatory diet is helpful because the brain is inflamed. When it's concussed, there's inflammation that happens. When there's chronic problem, there's inflammation that happens. So you must support brain healing and regeneration through diet and supplements. That's an important part of concussion recovery. And maybe mainstream medicine is starting to talk about this, but not nearly as much. It's essential, right? What you put in your body is what becomes your body, right? The proteins become, the fat becomes part of who you are. So it's so important to know what you're putting in your body and how that's impacting your whole system. And then finally, we have to look at the visual and vestibular system in concussion, right? So it's something that is impacted. If you think about where your vestibular, your balance and equilibrium system is in your brain, it's in your brain, right? So there is no doubt that with a blow to the head, a concussive force, that system is impacted. So it's essential. There are lots of strategies, lots of treatments for vestibular problems and visual problems. Lots of people specialize in this. Just seek them out. They exist and they are there to help you, including physical therapists. So, to conclude, I hope that you gained an understanding that really, A, concussion impacts a lot of people. B, the mainstream approach to concussion is not good enough. And C, there is an approach that is effective in resolving post-concussive syndrome and post-concussive problems. So now I'm just curious if anyone has any questions or comments. Maybe type in the comments where you're from and if you think you've had a concussion or if you know you've had a concussion. I'm just curious to see, out of the 12 of you I see here, thinking, yeah, I've had a concussion, I've had a blow to the head, I used to head soccer balls when I was a kid, or I got hit in the head when my volleyball partner was coming down with her elbow, or there's a doorway overhead that just dink dink dink, I keep knocking every time I come through the door. If anybody has any more questions, I can. Yeah, Tracy's here from Niwot, Colorado. Tracy Lee, she's my practice partner at the Healing Collective, and she's also the co-founder of Sleep Soundly, our Facebook group for women who need amazing sleep. And actually, I'll drop that link here in the comments in case you want to join our group if you know anybody. Let's see. Yeah. And Holly, hi Holly. Holly's literally right behind me. She shares the space with me here where we live up in the mountains in Colorado, and she has had a concussion. Yes. And Dee Brown, oh, hi Dee, it's so good to see you. Gosh, it's been so long. Dee Brown has had a car accident. Ooh, I'm getting a lot of comments. I'm trying to keep up with them here. Yeah. Let's see. Nicole is one of my wonderful colleagues in physical therapy school. She's another doctor. She has not had a concussion, luckily, but her brother has had 2. Yeah, so hopefully some of this information is going to really help your brother get some relief. Is your brother still struggling, Nicole? Does he have any issues, anything that he's struggling with now? There's a little time lapse, I know, between me asking questions and things popping up here on my screen. Sue Tierney from Illinois had a concussion during a car accident 16 years ago. Sue, do you have any symptoms that are still bothering you to this day? If you want to add those to the comments. Joanne from Cedar Woolley, hi Joanne, doesn't have any concussions that she recalls. That's awesome. That's wonderful. Yeah, Nicole's brother, who's had a few concussions from sports, has headaches and neck pain, and that is a common complaint. And the headaches, especially, can be related to just the brain being in a different position or scarring in the dura. We didn't really talk about that in my talk, but the encasement of the brain and spinal cord, the dura mater and the arachnoid and pia mater, they're layers that protect the brain and spinal cord. And when that gets when the blow to the head happens and the brain shears, the dura can also shear, and then the way it heals itself is by laying down scar tissue. If you think about getting a cut in your arm and then the scar tissue forming, it's a little bit different tissue than your normal skin, right? You always know that there's been a scar or there's been an injury there. Same thing happens with the dura when it heals. It can sometimes, when it heals, adhere to the cranium or adhere to another structure. The dura can adhere to the vessels potentially. And so one thing I didn't talk about that I love as a tool for helping to treat concussion is called frequency-specific microcurrent. And it's this amazing tool that uses pulsed electric current, very, very low amperage. And it can send current through the spinal cord and the brain stem. And what it does is it has been shown in cytokine studies to decrease inflammation, decrease the inflammation response of the brain. And that can dramatically help with concussion syndrome, with headaches, with head pain, with pressure, etc. It's not like the only thing that you need to treat concussion. I really strongly believe that the structure of the cranium and that manual work that we do is essential to helping with concussion. But FSM is an incredible adjunct because it can eliminate symptoms really quickly, right? It can get to the root and get rid of that inflammation, get rid of that pain, and really help people. Thanks, Nicole. Yeah, neck immobility and memory loss from Sue in her post-concussive issues. And so with memory loss, with these structural changes, right, maybe there's a part of the brain that got bruised, or maybe there's a part of the dura that's not allowing the cerebrospinal fluid. It's this beautiful fluid that, well, beautiful, I've never seen it, but I assume it's lovely, flowing around your brain and spinal cord. And it is another mechanism that helps to clear toxicity out of the brain. And so sometimes with a blow to the head and that malalignment of the cranial bones, that fluid can't flow as easily. It gets, maybe there's a part right, over here where the blow happened, where the fluid just gets stuck and gets pooled or doesn't efficiently move through, or it just goes around this area. So this part of the brain that's related to memory or related to cognitive function, to word finding, might just not have that enough nutrients and enough ability to clean itself out. And then over time, as those toxins accumulate there, and this is a hypothesis, right? This is not something you're going to find in your medical book, but as that accumulation happens, your symptoms get worse and worse and worse. Oh, thanks for asking, Tracy. So my friend who had the concussion, that horrible work accident, who really helped spur me onto this whole investigation of alternatives and things that actually work for concussion. Did he ever actually heal? And yes. So he is one of the reasons I know about that Simkevich Cranial Institute and got introduced to these cranial mobilization techniques. I was actually trained by the Institute of Physical Art in those cranial mobilization techniques, but this friend of mine was treated at the Simkevich Cranial Institute. He had almost immediate results from that. And then he went on to get some treatment, some manual therapy treatment through a physical therapist in Bellingham, who really made a huge difference for him. And then he also got a home frequency-specific microcurrent unit. He actually got to meet Dr. McMakin, who's the founder of FSM. And if you're interested in learning more about this, join our group Resonance Rising. I dropped a link into the comments earlier. And so if you join that group, you can learn all about frequency medicine and how it's really literally changing medicine. So this friend of mine, he did the manual therapy, he did the frequencies, and he was quite resistant to supplementation for some reason. He always followed a anti-inflammatory diet, but then when he just recently started doing supplementation, so for him, like fish oil and magnesium and CoQ10 and some of the really helpful brain supplements, they have made a huge difference for him. And that's just recently. So yes, he's rocking it. He's in graduate school, getting straight A's, where before, when he went to a neuropsychologist, the recommendation with the neuropsych was to take a year off of school and go and take an art class at a community college. And now he's in this high level science degree program and doing a really great job. So yes, this guy couldn't even read his phone or a computer. And he went from there to now rocking grad school with straight A's. So yes, there's the end of his happy ending. Nicole says, I know someone who has rolled their head side to side in order to sleep since they were young. I feel like brain damage could have definitely occurred. They were supposed to grow out of this at a young age, but never has grown out of this. Do you think all of this could be related to continual brain damage and thus vestibular deficits leading to a vicious cycle? Wow, yeah, that's a really intelligent question. And yes, it could very well be that it could be either way. It could be that there's an underlying vestibular issue that this rocking side to side helps this individual fall asleep. And treating that underlying vestibular issue could help improve or resolve that habit. It could be that, like you're saying, some initial head trauma is causing this issue to continue to happen, and it's creating a vicious cycle. So I would really be curious to investigate this person's cranium just from a structural standpoint, and then take this person through a full vestibular screen and just see if you can identify any specific deficits. And Nicole, I know, is a physical therapist, so she will have the resources to find this. And if you are, if somebody's curious about the answer to this question, you would definitely have to see a provider. You have to see someone who has specialized training, and you'd look for somebody who has vestibular training or specific concussion training, a physical therapist or someone who has osteopathic training, specialized training, right? This is, like I said, I keep saying this, and I hope this makes sense. This is not something that you learn in your mainstream medical program. This is something you have to go to extra training for and learn about and study and become an expert at. So, so thank you so much, Nicole, for that question. Does anyone else have questions? I really appreciate you all being here. Thank you so much for just listening, and I hope this serves you, and I hope you share this with people you think might benefit from understanding this information, right? So a concussion doesn't have to be that you lost consciousness or that you got smacked in the head. It really doesn't have to be that extreme. It can be, certainly, but it doesn't have to be. It can be small, repetitive, cumulative effects over time. And there are treatments, and they are effective. And so I really hope that this reaches a lot of people and helps a lot of people. Thank you so much for being here. And again, we have, if you know anybody with concussion, I would love to offer a free consult. I offer free 15-minute consultations at the physical therapy clinic that I work at. And right now we're doing all telehealth because of the precautions. So I'd be happy to get you connected just with some information if you need more. I also offer FSM treatments for FSM units for people. I am able to, if you have the correct diagnosis, I'm able to prescribe frequency-specific microcurrent, and they send it to your home, and you use it at home, and you treat yourself. And especially during this time when you might not be able to get into a manual therapist who can do physical mobilization of your cranium right now, but you can have access to an FSM machine that would at least dramatically improve your symptoms until you are able to get into someone and address the root cause, which is that mechanical deformation or malalignment. So thehealingcollective.us is our website. Facebook group is called Sleep Soundly. We also have a frequency medicine group called Resonance Rising. So those are 3 ways to get in touch. And as always, if you have questions, just reach out to me with a message or send me an email through our website. Follow our content on Facebook. This is just the first of a lot more to come with information about how to help insomnia and just your overall well-being. So thank you all so much for joining me. I appreciate you all. Thank you, thank you, thank you. Until next time.